with hot flushes, night sweats. There can be mood changes, changes to one's sleep, changes to one's libido, dry vagina. And this is a rite of passage that women get to go through at around 50, 51 years of age.
Now, is it normal to still have periods at 54?
Absolutely it is, because remember the range that is considered normal to stop your menstruation is anywhere between 45 to 55, but there will be certain women who fall outside of those limits. So there are some women over 55 who are still menstruating, and there are some women under 45 who have become menopausal. So for the vast majority, it's 45 to 55, but you do get the occasional outliers on either side.
Now, how long does menopause last?
So menopause is the next phase of your life after your reproductive years. So once you become menopausal, you are menopausal until you die. The question really is, how long are you going to be symptomatic for menopause? And that can be very variable based on the individual. So for some women, they will struggle with menopausal symptoms most intensely for the first few years after they stop menstruating. And that's more typical, usually for the first 5 to 10 years. But beyond that, many times the symptoms will ease off. But once again, there will always be women who don't have that experience and can have strong menopausal symptoms well into their 70s and 80s.
So, what are the signs of menopause, or is it called premenopause?
So the terminology that is often bandied around is perimenopause. So that is that phase in your life where your periods start to become irregular, where you start to have these changes that are different to how you were before, and they go on, that perimenopausal period goes on until you haven't had a period for a full year. Probably the better way to describe it is to call it the menopause transition, because it is a transition phase in your life, and it's of variable lengths depending on the patient. But the strict definition of being fully menopausal or postmenopausal, if you will, is when you haven't had a period for a year.
All right. So I'm just trying to understand all of this. So there's perimenopausal, premenopausal, and menopausal, and postmenopausal.
So basically, you are premenopausal when you're in your reproductive years. You are perimenopausal when you start to go through that transition phase. And once you haven't had a period for a year, you become postmenopausal, and that is how we are for the rest of our lives.
Okay, all right. Okay.
But you may not be symptomatic for all of that time. The time when you're most symptomatic will usually be for the first 5 to 10 years after that last menstrual period. Truthfully, these definitions are semantics. It's not a linear thing at all. And the definition of perimenopause versus postmenopause is a very artificial definition, because if a woman is missing periods at around 50 years of age and she's having hot flushes and night sweats, but she had a period 2 weeks ago, we're not going to deny her menopausal hormone therapy just because she's still menstruating intermittently. So we mustn't get too bogged down by the definitions of these things.
Does early period mean early menopause?
Not necessarily.
Oh, all right.
Not necessarily. Often what you do from a menopause point of view is predicted by what has happened to the female relatives in your family, your mum, your sisters. That can be altered a little bit by women who have had hysterectomies. So sometimes it can be difficult for a woman who's had a hysterectomy to know when she becomes menopausal, because of course one can't apply that definition of last menstrual period to her. The other thing that has changed things somewhat is using certain intrauterine contraceptive devices that contain hormones. Those also can take periods away, and then it can be difficult to tell exactly when it is that a woman has had her last menstrual period. But once again, drawing the line in the sand is not strictly necessary. If she's symptomatic and it's affecting her quality of life, and she's at the right age, and it looks like that's what the problem may be, then we don't deny her treatment if she is open to it.
I know some of the times we misdiagnose ourselves, thanks to Google. I know some people who always be like, "Oh, I'm sweating so much. I'm getting hot flashes. I think I'm having menopause."
Yes, absolutely. And if they're in the right age group and they are missing periods, then they're probably right. But if you have got a patient, for example, who is in her early 30s and she's missing periods, she may be perimenopausal, but one needs to think about other things like thyroid problems, pituitary problems, eating disorders, all of those sorts of things that can also lead to a loss of periods. But that is for women where one wouldn't expect menopause to be likely given the age.
So how can we better deal with the menopause?
I think a large part of it has got to do with how we see it as a society and how we approach it culturally. For many women, it's a sign of, oh, well, that's me now, I'm going downhill, I'm getting old. And it's a pity. It shouldn't be seen like that, because as a matter of fact, a lot of good things can come from being menopausal. For example, the fear of pregnancy is no longer an issue. The heavy, painful, uncomfortable periods become a thing of the past. And there's a lot to be said for those things. Also, the comfort. Hopefully, women become more comfortable with themselves as they get older. So there's a lot to be embraced as we age, and I think menopause is just a small part of that. And how one approaches it from an attitude point of view, I think, can go very far. Secondly, I think how you look after yourself from a lifestyle point of view is very important. Understanding that this is a different phase in your life, and you have to be a little bit more careful with what you eat and how much you eat. You can't get away with not exercising as you could in your 20s. One should really start an exercise program. And all of those things can really go a long way to making you feel better in this new phase of your life. And then for women who are struggling with symptoms that is affecting their quality of life, or for women who have got osteopenia, so in other words, they've got their bones aren't that strong, they've got the potential to develop osteoporosis in the menopause. But for these sorts of women, there is a wide range of menopausal hormone therapy that is available, that you can get through your GP or your gynecologist if after a discussion around the pros and the cons, if that is something that you would like to use.
All right. So thank you so much for your time and for the chat, Dr. Judith. Well, at least it's not a death sentence, just another stage in our lives.
Absolutely. And it's a great time in our lives. And truly, we are going to be spending a very long period of time in this phase. So we need to find a way to embrace it.
All right. Thank you so much. And have yourself a lovely day.
Thanks so much. Take care. Bye.
Bye-bye. Dr. Judith Cada, an obstetrician and member of the South African Menopause Society. And as she said, menopause is the last stage of your life. Yeah, it's time to embrace it and stop worrying about all the hot flushes and sleep disturbances and mood swings that you have to incur. It's part of the journey. It just like it happens when you have menstruation. Guess what? Something else happens during menopause.
Discover the Africa of your dreams and surround yourself with her spectacular beauty. Relax beneath her serene sunsets and explore wildlife at its natural best. It's where the pride of Africa comes together. The Kwantu Private Game Reserve. Get to know the Big Five or cruise on an elephant safari game drive. Interact with lion and tiger cubs and enjoy world-class halal cuisine while we pamper you during your 5-star stay. Indulge in the true African experience. For reservations, call now on 042-203-1400 or visit kwantu.co.za. The Kwantu Private Game Reserve, the place of gathering.
Shukran, Danki, Sia Bonga, thank you from Islamic Relief. Your donations improve the lives of over 11 million people in 43 countries. The victims of conflicts, natural and man-made disasters were given hope because of your generosity. Thank you for easing their despair and especially for giving a smile to over 72,000 orphans. This year, we stayed apart but came together to help the people most in need. We thank you. Follow your donation on www.islamic-relief.org.za.
DusiMed Medicine Depot Retail Pharmacy and Emergency Medical Depot, conveniently situated in the DusiMed Medical Center, corner Burger and Bosser Street, Pietermaritzburg. We provide safe, affordable and convenient medical facilities, open till 10 p.m. every day of the year. We have a full house clinic that operates from 2 p.m. to 7 p.m., which is run by a qualified sister. The clinic offers immunization, vaccination, wellness, general consultation, and more. Call DusiMed Medicine Depot on 033 3421 DusiMed Medicine Depot, your pharmacy of choice.
Connect and stay ahead with Salam Media. This is Salam Media coming to you